Hi, my name is Dan Hanson, founder of dentalbraces.com.au. I'd like to introduce to you Dr Derek Mahoney. For those of you just starting to research orthodontics and haven't met Dr Derek Mahoney before, I'd like him to just describe his career to date and how he came across FJO Orthodontics.
Sure. I trained here in Sydney as a general dentist and was very interested in orthodontics, but the training that I had here as a general dentist was really based on treating children once they had permanent teeth. And the way, and this is over 20 years ago, the way we would initially approach our orthodontics was to make space by normally extracting teeth. I then went overseas and did my Masters in orthodontics, and that opened up my eyes a little bit more into modern concepts, however still largely based on waiting until the child's jaw had stopped growing and then trying to remedy the dental crowding problem. I guess the change in my career occurred when I was able to do some research in Sweden at the Karolinska Institute, and I was lucky enough to be exposed to the relationship of nasal airway obstruction to the growth of the face. A child who breathes with their mouth open tends to develop a longer face, and that led me into the whole concept of understanding functional jaw orthopedics, where rather than wait until a child's facial maturation to be complete, we like to get in on children who have narrow palates during the growth phase, and we'd like to assess things that I never looked at in my traditional orthodontic training, such as their breathing, their method of breathing, such as the size of the palate, and such as their facial balance.
And so whereabouts did you learn your specialist orthodontic training?
I did my master's degree in orthodontics at the University of London through the Eastman Dental College, which is a postgraduate only facility. I found the course to be quite challenging, but still largely focused on the traditional approach to tooth movement. I think a lot of the missing pieces in what helped me to put together a program that I now teach as well as I certainly practice came from listening to other greats in European style orthodontics who understood that there was a relationship between guiding the growth of the jaw, which is what we call orthopedics, in the role of a modern day practice, as opposed to just conventionally moving teeth, which is a traditional orthodontic approach.
Okay.